Welcome back to the Morning Blend. Women aren't the only ones who are self-conscious about their bodies. Many men hate the extra fat tissue on their upper chest. Gail Coleman is here with Aesthetica with a procedure that's called Coolsculpting that can really help. Nice to have you on the show.
Thank you.
There are different words that we use for that fatty tissue. I mean, man boobs. There are different expressions that we even joke about, but the reality is many men have it. It's embarrassing. And just like women who want to make changes, men are in the same situation.
Right. This young man that we just showed the photos of was extremely self-conscious when he walked into the office the very first time. And when he came back for his check and the after photos, he was like a different person.
Well, what I think is amazing, Gail, is that this was, am I right that this was after just one treatment?
Right.
How does keep the picture up just for a moment if you would, how does the treatment work? Because you're specifically targeting that chest area.
Correct. So Coolsculpting is the science of cryolipolysis. It means that we freeze the area, crystals form in the fat cells, and the crystals cause the fat cells to actually burst, and your body slowly metabolizes and gets rid of that fat. It's great for localized areas like that you cannot target with diet or exercise.
And obviously we're not saying this is the only area that you can target with Coolsculpting, but I think it's great to show the possibilities of this treatment because we're always talking about women in the midsection, but this kind of opens people's minds and to the opposite sex that this can work for them as well.
Right. We have many male patients that treat abdomen and love handles as well, but our female patients, they treat anywhere we can get the device to attach to.
The arms, the hips, yeah, the thighs.
Saddlebags.
Exactly.
Right.
Speaking of the midsection, we're going to show a picture. This is the first picture that we have. Actually, the first and second are both of a man, and this is the midsection. Talk about how you use the procedure then on the midsection and love handles.
On the midsection, it depends what the patient looks like. Sometimes we freeze upper and lower abdomen and then love handles. I love this before and after of this particular patient. After one treatment, he had such a sculpted abdomen and looked extremely athletic. He was thrilled.
I bet he was. And I think, again, it shows the possibilities because there's muscle under that. It's sometimes just hard to get those targeted fat areas to reveal the muscle underneath. The last picture that we have is a woman, and I would think the midsection is probably one of the most popular areas that you treat.
It is, and I picked this particular patient because she was a younger patient and after 2 babies, and she just had a little bump of fat. This was one treatment, this actually was only one small handpiece, and what a fabulous result, very cost effective, and she was thrilled as well.
Is it painful, and do you see it as an option or an alternative to traditional liposuction?
I absolutely see it as an alternative to liposuction. The procedure feels like a mammogram on the area for about the first 10 minutes, kind of a squeezing, pinching sensation, and then once the area is frozen, most patients don't even feel the treatment at all.
Do most people require more than one treatment to get the kinds of results we saw in those photographs?
If you're within 10 to 15 pounds of your target weight, I would say most patients only require one treatment. Patients that have more excess fat require multiple treatments.
Can you do multiple areas at one appointment? In other words, could you do, say, the midsection and for men, the fatty tissue on the breasts and the thighs?
Sure.
For an example.
You can do multiple areas in the same day.
Okay, and then how long is it after you do the treatment that people will then see those results like we saw in the pictures?
The results that we showed are about 8 to 10 weeks after the treatment. Your body needs to metabolize and get rid of that fat. Happens slowly, so it's FDA cleared and it's totally safe.
I didn't realize. Okay, so the results obviously aren't immediate. It's something that your body then processes. Are there things that people can do to help, for example, drinking a lot of water or exercising?
That doesn't make any difference to the fat that we're freezing. This fat is not dependent on diet and exercise. That's what's so special about the treatment. Diet and exercise will affect the other fat that is in your body.
Okay, and I think that's good news for people, and also to know that it's FDA approved and safe, and that it's relatively pain-free. Cost effective, you would say, without the risk, which is fantastic. So we're going to give people information because right now you have a special offer, and it's $250 off the first Coolsculpting procedure. And the reality is, a lot of people, like you said, if they're somewhere within their target weight, might only require one procedure, which is fantastic. So again, make sure you mention the Morning Blend when you call Aesthetica, and mention the special offer for $250 off. They have 2 offices conveniently located located in both Mequon and Delafield. To make an appointment or consultation at their Mequon office, call 262-240-0655 or in Delafield 262-646-9222, and the website you see there is aestheticaskin.com. And can people work out after the procedure just real quickly?
Immediately.
Immediately they can. That's fantastic. Thank you so much for being here today.
Thank you.
Appreciate your time.